So thank you everyone for joining us today for this virtual training session on maximising your practice's emergency response planning tool. We welcome John Williams today to present to us. He's coming from New Zealand, so thank you so much, John, for your time today. Quite an extensive bio there. John's worked in a number of large multinational organisations, and we're really grateful for his expertise that he's bringing to us today. John will be running through some of the key modules in their emergency response planning tool, and they're just listed here. Just a little bit of housekeeping. If everybody can be on mute, just to optimise the sound control, but do unmute yourself if you want to ask a question or make a comment, and just let us know who's talking. So unmute and say, it's Fallon here, I'd just like to ask a question. If you can't unmute or would prefer to just ask a question via the chat button, please do pop your questions into chat and I can field those through to John as the session is going. And we are recording this session, although I think it is better to attend in person and participate, and it will be run 2 more times as well. So if you've got other staff you want to come along, please get them to register for the following 2 sessions. Before I hand over to John, I'd just like to do an acknowledgement of country. I would like to start the meeting by acknowledging all the traditional lands on which we sit. I'm in Bathurst, which is Wiradjuri land. I pay my respect to elders past, present and emerging, and acknowledge their continuing connection to land, water, culture and community. We are committed to working in the spirit of partnership and collaboration with our region's Aboriginal peoples and communities to improve their health, emotional and social well-being. And I warmly welcome Aboriginal and Torres Strait Islander Australians who are present in this meeting today. And I will now make John the presenter so that he can share his screen with you and take us through the emergency response planning tool.
Thank you very much, Cody, for the opportunity just to talk to you about the ERPT. We've been working with the RACGP, the Royal Australian College of GPs, since 2013 with this platform. Now, by way of background and setting the context, the content in the ERPT comes from 2 guidelines. Guidelines are from back in 2013, but they've been recently added to, and I'll tell you what those additions are. So the 2 guidelines are managing emergencies and managing pandemics in general practice in Australia. And those guidelines were developed with a working group from the RACGP, including practice managers, practice nurses and GPs. And so the content that sits in here is pretty well applicable no matter where you are, but obviously dependent on where you are. Some of the risks per state are considerably different. So the tool enables you to move some of those risks into different priority places. Because it's the recommended tool for emergency and pandemic planning by the RACGP, it automatically complies with the 5th edition of the GP standards towards accreditation. So if you use the ERPT, then it's an automatic tick when the accreditors come around, as long as you have completed it to their satisfaction. So what I'm going to show and run through with you today is how we actually go about working with a practice using the ERPT and giving them confidence that they can get, it's very simple to use, it's intuitive, and getting them underway. So what I thought I'd do is I'll give you a bit of a background on how the tool is set up, and then at the end of each module, and I'll go through the modules that Katie put up on the initial screen in sequence. At the end of each module, I'll just pause and ask if there are any questions. If not, we'll keep going. And then right at the end, we'll open it up for questions again. But as Katie mentioned, certainly using the chat function is another option as well. Okay, so if you look at the screen, I've actually logged in. And I've got a series of buttons. In the center, this is a demonstration plan. It's got the name of my practice and a button that says Edit Response Plan. So we give you a unique username and password for each practice. Now, just to give you some certainty around security, it's an online tool. It sits in the cloud on Amazon Web Servers based in Sydney. And we believe that that's a good place for them to be because of the security around it. Not that there's patient-specific information in the ERPT, but what there is proprietary information that is important to each practice. Now, if a practice manager asks us to get in and have a look at their plan, and some do, just to say, hey, does it look right? Or if they are not sure where things are and want us to check, then they have to give us permission. We can get in and have a look at their plan, but there is an audit trail. So I've got to put a reason in to actually have a look at somebody's plan. Anybody can request that audit trail at any time. Okay, now as I move down the page, you'll see on the left-hand side, there's a video tutorial. There's also a download button, which puts a reminder into the user's Outlook or whatever electronic calendar that they use, just to go and check their ERPT document 6 monthly, because things change. And it's really important to keep the information current and accurate. You'll also notice that underneath here, there's an upload button. Now, what that means is that the practice can upload documents into their ERPT, take them off their systems. And typically what we say and what we see is practices will put policy documents in here. Can be HR policies, they could be even things like an evacuation plan or a site map. Now in the published or printed version, then it will notate what documents have been uploaded into the plan. Okay, so I'm going to move quickly into edit response plan. Now what you see here, just from an orientation perspective, is you see down the left-hand side a table of contents. You will see that there are 17 modules in the ERPT. As Katie outlined at the top, at the initial screen, we're going to cover 1, 2, 3, 4. Then we're going to skip down to 7A. Then we're going to have a look at 9. Have a brief look at 10, 11, 12, and then we're going to have a look at 14, 15, 16, and 17. And some of those will take longer than others. Okay, at the top of each page, now I'm in module 1, it says it right at the top, and you navigate by just clicking into each module as you go down. There is a help guide that helps the practices understand what is required. But the beauty about the ERPT is there is a lot of pre-populated information already included in the tool. So really giving the practice guidance on what they should put in here. So as they work through the modules, they're building their own personalized practice, emergency and pandemic response plan. Now, when we sit down with a practice, we recommend that they break it down into chunks and do, if they possibly can, 2 to 4 modules a week and set themselves a time frame to get it completed. Now in module 1, because the practice is registered, the name will automatically appear of the medical centre that they have registered. But they must go in there and complete in these grey free text boxes, the physical address, the contact details for the practice. Who is the emergency coordinator? And down here you will see where are hard copies of the plan kept. Now I'll put that in the right context as well. What we recommend is that there are 2 hard copies of the plan printed at any one time. So if you review it in December, then you should print out 2 hard copies. Keep one on site and keep one off site. Generally, it's the principal GP or the practice manager that has a copy off site. And I'll give you a good example as to why that is important. So just before Christmas in CBD Melbourne, a practice was broken into at 2 a.m. in the morning and set on fire. Luckily, the practice manager and the principal GP had a hard copy of their plan in place, because at that time when you get news like that, you go into a bit of a panic mode. So they grabbed their plan, they were able to ring up all their staff members because they'd included them in the ERPT, and they were also able to ring up all their suppliers or service providers and notify them that their building was compromised and they were going to set up somewhere else. So very important, and it just shows you the significance of having a hard copy. Now you'll notice down the left-hand side in the table of contents, there's a little green tick. Now what that means is that I have completed that module. I have clicked on the black button on the bottom right-hand side, the section is complete, and therefore it has put that green tick alongside that module. The reason that that's important is that you have to have that green tick there for that section to publish or print in the final version. There is one module, and I'll just point it out here, module 11, unique identifiers and contract numbers, where some practices may not tick that black button because they don't want that section printed in the final version. And when we have a quick look at that, you'll see the reason why that is the case. But I would say that probably only maybe 10% of practices would untick that specific module. Okay, so as you can see, we've got all the staff details in here, which state the practice is in. In your case, it would be New South Wales. And then if I do the drop down, it's got all the PHNs that appear. Okay. And then who is going to approve the plan and an arbitrary date that I have put in there. And that's what we just work with the practices over as we go through this to get this populated. And more often than not, I will help populate this with the practice manager at the time. So what happens now is this is where you enter the staff details. So I've put the practice manager's name, that's been automatically pulled down from up above anyway. But the rest of the functions are a drop-down box, and you'll see you can assign people to medical, nursing, allied health, admin, or IT internal. So we put Damien in there. We've put his primary contact numbers, his secondary contact number, where he lives in terms of suburb, and how long it takes him to get into the practice. And that's done for a very good reason. Now, as I scroll down, you'll see that we've included all the GPs under medical. We've included nurses. We've included administrative folks. And we have included allied health in there as well. And what happens then is you start getting a staff call-in tree that is developed based on how far away they live from the practice in function. Okay, and that can be quite useful should anything happen, an alarm goes off, etc. Okay, and then what we also coach the practices in is as we go through and you put your staff details in there, make sure you click on that bottom green button at the bottom right of the page. There's no auto save, unfortunately, so you've got to make sure that you save changes because practice managers are generally very busy people. And if they get called away, they don't want to lose what they've done. But if they click the save button, shut down their system, when they come back in, they can pick up where they last left off. So with that in mind, that's module 1. Are there any questions? Okay, I'm going to move straight on to module 2. And I go to module 2 because I click on that. As you can see on the center section, I'm in module 2, key contact information. Now, where we've got support agencies, emergency support agencies, these are all pre-populated. So if it's a brand new ERPT, I will work with the practice manager just to click into these boxes to make them live. So this has got all the details for emergency service providers in the region. You can see them all there. Now, I won't apologize for this section because it does take some time to get this information in. So this is your utility and service providers. But keep in mind that once they're in here, then it's a very, very simple job to update and change it and review it. So, you know, once it's included, it would typically take a practice manager about 20 minutes every 6 months to just go through and check it. Or if you are making changes as you go, say for example, you have a change in staff member, or a change in supplier, and you go in with your username and password and enter their details, then it's a very simple way to keep things updated and current and accurate. So we've got pre-headed boxes down here just to prompt practices of the kind of providers they need to include. So local council, power supplier, gas supplier, water, air conditioning, domestic waste, clinical waste, cleaning, security, even down to things like solicitors and accountants. So there's pretty well everything covered. Practices don't have to complete every box, it's only what the boxes they want to include. But again, think about it from the perspective, who would you need to contact in either an unplanned or an emergency event? And that's the same way of thinking about your staff members and who you should enter in there as well. Just make sure you think about who you would need to contact if anything unplanned or an emergency happened. Okay, so we've got all those details in there. Now, the importance of getting those in there is, and I'm just going to jump ahead, I'm going to come back, but just to demonstrate one thing. If I go to loss of power, you will notice it's asking for, in loss of power, your electricity supplier and your electrician, but you'll notice this peach colored area. So what's happened is, rather than re-enter that data, it's automatically pulled that from module 2, your main supplier and your electrician. So as a practice manager or whoever is completing this, they don't have to retype it, it just drags it. So any questions on module 2? It does take a bit of time to get that in there, but it's very important to get all those providers in there. Okay, we'll move on to module 3. Now, module 3 is a series of risks that are commonplace across Australia. Now, again, this list of risks came from the RACGP working group. Now, what will be different, depending on your locality, is the priority. And in some cases, some risks will not be applicable at all. For example, if you are in Victoria, tropical cyclone is not an issue, so you would probably delete that risk. If you're in New South Wales, particularly if you're in the area that you're in, bush or grass fire could be a risk. I don't think tropical cyclone is a big risk in your area, but certainly further north it is. So what you've got is you've got a series of pre-populated boxes. Now, most of this information is fit for purpose. So it identifies the hazard. There is some subjectivity required here. So, and we talk with the practice managers to say, what do you think the likelihood of this event is of happening? And what is the consequence? And when you look at that, those are drop-down boxes in each of these. Okay, so they've only got a limited number of choices. So it's the hazard and how you prepare, respond, and recover for each of those. So I'll just go through these. Bush, grass fire, structural fire, smoke, pandemic, flooding, threatening behaviour, heat wave, explosion, emergency exterior to the practice, tropical cyclone, severe weather or storm, gas or chemical incident. And there is another one, did I cover it? Explosion. I might have actually deleted that. Oh no, there it is there. Okay, now if you're in your area, I would suggest, because even though the risk of it happening is quite low, I would always move structural fire to the top. And I actually recommend that in most cases. And you see how I did that? I just clicked on the arrows to the right. Because we have got smoke in first place, I would therefore then put, fire in first place, I would therefore put smoke into second place. I'll leave that where it is currently, and then I've moved pandemic. You might argue that given the current circumstances, I might even move that into third position. Then I've got all these others here. So that's how we work with the practice, just to make sure that they're comfortable with the priority of those. Now you can add to them. If you don't like a section, you can just highlight it and delete it and start again, or you can add to it. So wherever there's a grey section, it enables you to type free text in. Right down the very bottom, there's the ability, and it's the same in every module, to add your own hazard if there is one specifically that would be different from those that are more commonplace. For example, if you were in our part of the world, i.e. across the ditch, I would make sure that I had earthquake in here if I was in a certain part of the country. In fact, I've done that in our own plan internally. Okay, any questions before we move on to loss of power? Okay, I'm going to jump into this. I'll just have a drink before I start talking again. Okay, now loss of power supply, we typically spend a reasonable amount of time with the practice manager just going through this. You'll recall prior, I mentioned that this information gets pulled from module 2 automatically. And then we ask questions like, if there's an internal power fault, who's the first contact within the practice? Typically it's a practice manager, but there may be a building manager that's more pertinent. We also ask specifically where the electrical switchboard is for obvious reasons. Somebody may have to just grab it and turn it off in a hurry. So it's important that you need to be as specific as possible, not behind the reception desk in the wooden cupboard. I would be a little bit more specific about that. And quite often it will be in the server room somewhere. And then we'll be asking the practice, and this is the practice has got the ability to turn these on or off. So that's what they would typically see. But I would ask them the question, have you got an uninterruptible power supply, UPS? 99% of practices do. More often than not, they are powered between 30 and 90 minutes and connected to the server which runs the network within the practice. So that is pre-populated. If that is different in your practice, you just change it. But in most cases, that's fit for purpose. Then we ask, have you got a backup generator in place? Now, if you're a metro practice, you're unlikely to. But if you're a more rural, say somewhere in Gippsland in Victoria, or perhaps in your area, or you may have the need to have a power generator connected. So if you do, that's great, you need to follow the instructions. If you don't, but you need to hire one if you're without power for a certain period of time, then you need to pre-organize that ahead of schedule. In all cases, no matter where you are, medical facilities will take precedent in terms of hiring a generator. But you need to find out where you can get that from, contact that organization, set it up ahead of time, and talk to your electrician about what it's going to power, the size that you require, and to make sure that the electrician is probably on site should you need to connect it. So just thinking about mitigating any of those circumstances. Then there's a little bit about evacuation and contingency measures if you are without power for a short period of time. So making sure that you've got hard copy Medicare forms, making sure that reception can use mobile phones to communicate to patients, making sure that you've got torches and lanterns available if lighting's an issue, and that you can transfer calls elsewhere. There is another one that's not in this demonstration plan that is in the template, and I think it's a good one, and that is if you have vaccine fridges, and most GP practices will have, of course, then if you tape the doors down and seal them, you'll get 6 hours without spoilage. So things like that are important from a contingency perspective. And then in the checklist, there are things like making sure the building is secured, but also do you have automatic opening doors in your practice? And if so, make sure they're in the open position. And if you have lifts, make sure you check the lifts that there's nobody in them. So some very pragmatic things to think about there. Module 5, 6, and 7, disruption of water, gas, telecommunications, and loss of IT systems, follow pretty much the same format. So what the ERPT does is it just guides the practice manager through some thinking about what they need to consider and plan for, because they don't know what is going to happen and they need to plan for a whole lot of different circumstances or scenarios. Okay, any questions on module 4? Okay, moving on, thank you. I'm going to go straight into module 7A, which is the Cyber Incident Response module. Now, this was added at the end of 2018 in conjunction with the RACGP and complies with the Information Security and General Practice Guideline put out by the college. So what it does is it asks a few questions around cyber security insurance. You have got notifiable data breach legislation in Australia, so it is important that practices consider having cyber security insurance. It's quite inexpensive, and if you do have, say, a ransomware attack, you can actually ring up your insurer and they will hold your hand through the process, and the outcome's generally much better. So I always ask that question of the practice manager. Sometimes they know off the top of their head, other times they need to go and have a conversation with the principal just to see if that is the case. Now, what follows now are some very pragmatic guidelines for the practice team in total, should anything happen in terms of a cyber incident. So, for example, somebody in the practice makes a mistake and clicks on a phishing link that they should not have. What do you then do? So I'm just going to run quickly through some of the scenarios. So if you receive a suspicious email, you do all these things. And these are pretty well fit for purpose. They're pre-populated. The practice manager just needs to click into them to make them part of the plan. If you've clicked on a link or opened a download, if you receive a suspicious phone call, you do all these things. If you think you've been scammed, if any of the following things happen, random pop-up messages appear, extra toolbars appear, you do these things. If you've landed on a suspect website or downloading software that appears suspicious, if your antivirus software has displayed a message, if you've given control of your computer to somebody unintended, if you've had a ransomware message or attack, don't pay, but do all these other things. If your login details have been compromised, if your computer or website appears to have been accessed, if your practice website is hacked, if a data breach has occurred, okay, you do all these things, and there's a link to the notifiable government agency in Australia because you have to notify them, and that's the end of it. So in most cases, as I mentioned, you just click, make them live, then you come down to the bottom, tick the section as complete. So if I look at my left-hand side, as I go down, as we're working with the practices, we help them get started on module 1. We help them get started on module 2, but most of it's up to the practice. We get module 3 live, we get module 7A live, and we get module 17 live at the time. And the reason that we do that is because it gives the practice manager confidence, and also it just gives them a bit of it's almost a positive thing to say, I'm underway, I'm now going to make the time and get in and complete the rest. Okay, so that was 7A. I'm not going to go into loss of business records. I'm going to go into complete or partial loss of premises, which is module 9. And the reason for this is because a lot of practices don't think about this, but they should. Even though the chances of this happening are slim, it's still important to have this in place, because I have seen firsthand at least 5 occasions where a practice has had an incident where they could not get into the practice the next morning, and therefore they have to have thought about relocating. Now, if they haven't thought about it, then it's a panic to try and think about getting relocated. The other option is you shut your doors. Shirlene, that's a very good example, and I use the example of that one in central Melbourne too quite often that I'm aware of. So very, very important. Practices do burn down, and you need to think about where you can co-locate. You know, are you going to go to a sister practice down the road where you've got a relationship, and have they got room to take your staff members? Is there somewhere down the road that you could go to a vacant office? etc. So think about that from a practice perspective. But there's some other practical things you need to think about also. You need to clarify with Medicare Australia or the RACGP that you've got clearance to use your usual provider number at a different location. You need to think about where you go, and if alternate site arrangements are part of the plan, then set that up. And this is where in the ERPT you put those details, including the phone contacts and the person who you would need to get hold of at short notice. And then it asks you things like, how are you going to get clinical supplies, pharmaceuticals, telecommunications to the new location, and what needs to be done before moving in, how long it's going to take you, how you're going to get other supplies there, and who's going to do that for you, and alternate working arrangements for partial loss, and alternate working arrangements during a pandemic. So whilst this is not a hugely long module, there is some internal thinking and discussion that has to happen before the practice has the answer and builds their own response. And that's the way that you've got to look at this. It's about the practice building the response that's most important for them. Okay, any questions? And Shirlene, I appreciate those couple of examples that you put into the chat. Any questions on loss of premises? Okay, all right, we'll have a quick look at loss of medical supplies without wanting to belabor the point. Okay, so what I say here when we're talking with the practices is this module in particular, because this goes through a whole lot of consumables. Module 16, the pandemic, there's sections here that I would pass off to your practice nurse because they are the ones that will know where the different supplies are and what is the quantity. They're usually the ones that are doing the ordering in most practices. Okay, so what clinical equipment or requirements are essential to core service delivery? And there's a lot of prompts in here to make practices think about what to include. But don't forget there's also that guide at the top. So we've already pre-populated some of these things in here like stethoscopes, blood pressure meters, and so on and so forth. And then PPE gear. What's the quantity required? Who's the supplier? I haven't completed this fully as comprehensively as some practices would, by the way. Medical supplies and consumables to deliver core services. There's some suggestions there. Again, you can add your own, you can delete these and start again. It's very flexible. Pharmaceutical supplies, vaccine supplies, and other gear, and even furniture, appliances, and office equipment, if that is something the practice manager wants to include as well. Any questions on that module? You'll see it's fairly standard. Most GP practices being SMEs, small to medium enterprises, generally haven't got the expertise to develop an emergency and pandemic response plan. So having a structure that you can work through in a templated way is quite a good thing to do. And most practice managers that do complete this, it almost becomes a bit of a guide or a Bible to them in terms of where everything is in one place. So it's really worth working with the practice to ensure that it is firstly comprehensive and secondly published. Okay, so now I'm going to jump into unique identifiers. Now, unique identifiers, and this is the module 11, that I touched on that we'll just briefly cover off. So if you actually include all your staff members in module 1, then they will appear in here, but you've got to add in things like, you click on the add box, and then for Emma, I can add in a provider number. I can add in a prescriber number, and so on and so forth. So in my demonstration plan, I've done that for the doctors and for the nursing staff where you would put in registration numbers, and for allied health the same. And any secure information, this specific under here, this will not print. I've just put as an example the code for the safe. You would not want that in the printed plan for obvious reasons. Now, if I go back up to the top, you'll notice that there's a section in here where you can put commonly accessed information that's important. So I've put in here bank account, GST number, ABN, and those are all in the drop downs. Okay. Any questions on that module? Okay, I'm going to quickly go into module 12. So module 12 is around communication during an emergency response plan. So who does the practice have to communicate with if something happens to the practice? First and foremost, it's patients. And how would you do that? Now, I've actually deleted a number of these. It's even got things like notification via Facebook. So pre-populated, but the practice then has to go through and decide what are the most appropriate ways to communicate to their patients. And therefore they can delete them by clicking on that, and they can move them up and down in priority. You'd also need to notify your PHN and any other parties if anything happened. So local pharmacies that you work with, medical specialists that treat your patients, diagnostic providers, pathology service, residential aged care providers. You would probably need to notify them, particularly for that one if you're supplying services to them, and any other key business contact information you need to include. So that's module 12. There's a bit of information around media policy and who's the spokesperson, etc. in there as well. It doesn't take that long to complete that section because a lot of it's pre-populated. Any questions on that section? Okay. All right, moving through. Module 14, loss or non-availability of key staff. Now, we usually spend a little bit of time here, particularly given the current circumstances, because if you've got somebody in your practice that comes into contact with a COVID positive case, then they're going to have to isolate, and so is everybody in the practice. So do you shut your doors, or would you actually recruit some new people in the interim? And if so, would you use a locum agency for medical nursing and admin? And you'd put those providers up into module 2, as I have, and you'll see they've pulled all the information down into this module anyway. Okay, and then the impact of major events on staffing levels, and a place to put emergency access to secure systems and areas information, because quite often if somebody is ill or they're not around for a period of time, they may have access to systems that the rest of the staff don't have. I would put that detail in here, including key codes, or where are swipe cards kept, etc., etc. Okay, I'm not going to ask any questions in that area because I think it's fairly self-explanatory. I'm going to jump into the BCP, or the business continuity planning section. I spend a little bit of time here because it's quite confusing to practices. They don't understand what to include in here. Even the help guide, they tend to overlook. So I always say to them, go and have a look at the help guide, but also think about it from this perspective, because this is an area the accreditors focus in on. They like to see that a practice has spent a little bit of time and have at least 2 to 3 priority functions or activities that they would need to restore quickly, first and foremost. And one of the examples I use when I'm talking to practices is, have you got anything contractual that you have to provide? Okay, so yeah, thank you, Shirlene. I think that's a good point too. So for example, do you provide GP services to an aged care facility? If that's the case, I would put that in here. And then who's the staff member responsible? Who's the backup? What's the permissible maximum outage time? How many staff are required to fulfill that obligation? What about premises? What's required? What clinical equipment is required? And what IT is required to fulfill that function? And you can add other rows in there as well. And then what I would then do is I would I would add another table. So you can add a table, and I would put in something like Medicare billing or payroll as another important function for the practice to get up and running quickly. Okay. Of course, I'm being probably a little bit naive in terms of not knowing general practice that well. There may well be others that are ahead of that, but that's just an example. Okay. And then what about utilities and the priority of utilities? I always put premises first and foremost up the top, and I've moved that up the top with the arrows, and then power, telecommunications, IT systems, and water in that order. I think that's an important order. Most practices do. So that's the BCP part. Any questions on that at this point? Okay, moving on to module 16, the pandemic. Again, just to reiterate, this complies with the managing pandemics in general practice. Now, this was revised again last year to be more comprehensive around the COVID-19 situation, because prior to February last year, 2020, it was more around influenza. And as you know, 2017 was the worst influenza year in Australia right across. So it's really important for people to know and to be prepared for pandemics such as that. And now we are right in the midst of one that is more nasty altogether in terms of its impact on people and the whole country. So what the pandemic section starts doing is it really asks questions of the practice. You need to appoint a pandemic leader. Again, once you've got everybody in module 1 and your staff, they appear in the drop-down box. And then you can appoint them to various roles. These are all pre-populated and in the main fit for purpose. So the practice manager just needs to click on them. So key roles are for the pandemic leader, all these things. For the 2IC or the backup, all these things. For the communication coordinator, their key roles. What do you need to think about as a practice from a staff rostering perspective? What about staff members willing to work during a pandemic? In the pandemic clinic, for example, if you've got staff members that have elderly living with them or immune compromised loved ones, you need to know that as a practice manager, and you need to notate it in your ERPT so that you're aware of people's personal circumstances. And these are just yes, no, so they're pretty easy. Then there's an immunization register. Now we pre-populate this for practices as some suggestions. Now most practices would take tetanus boosters out, but the others are generally applicable, including, when available, the severe acute respiratory syndrome coronavirus 2 vaccine. In your case, it started off being the AstraZeneca one, but more so, particularly for under 50s, you've got the Pfizer one, which is the one we have over here as well. And then underneath that is a training register. Who in the practice has been trained in what? We pre-populate this with hand hygiene, infection prevention and control, cleaning, and most importantly, application and removal of PPE. So you can list all your people and when they've been trained. And then this is the area that you will recall I mentioned, give this to your practice nurse. Right, what are the consumables that you will need during a pandemic? Typically it's 2 to 4 weeks for a practice is the recommendation. 4 weeks being for a larger practice. And we have already pre-populated some suggestions around consumables, and they're all in here. So the practice nurse goes through and says, right, we've got X number, and this is where they're stored. Then there's a section on infection prevention and control. Where in the practice, what's the risk? What do you do to mitigate it? And action in the event of, and who's the staff member responsible? Then there's a cleaning policy. This has been updated with the latest information from the RACGP in terms of process and product. There's a waste management policy. There's managing the facility during a pandemic, and then that's it. And you'd save the changes once you'd completed that. Any questions on that section? Okay, moving on. Right, module 17, which is the last one, and this is the one that we can also one that we complete with the practice. So we get 3 fully completed at a orientation session, video call, and we get a number, as I've gone through, partially completed. That way it gives the practice manager and the practice a real step up in terms of completion. Okay, so the COVID safety plan was introduced into the ERPT 2 months ago in conjunction with the RACGP. So the content comes directly from the college, and it's about developing a COVID safety plan specifically for general practice in Australia. And here's the objectives. Our practice is dedicated to the health, safety and well-being of all team members, patients, contractors and visitors. In this pandemic environment, we acknowledge additional precautions are required, and these are outlined below. Again, these are pretty well fit for purpose, and the practice manager just needs to click in to make them live. So there's some suggestions around patient access and flow, physical distancing, infection control training, use of PPE, environmental management and cleaning, record keeping, practice team management and limiting interactions in closed or small spaces, responding to a positive case or close contact in the practice team, a review date. I always say 6 months, review it, just to make sure it's fit for purpose, and all the contact numbers, which I put live for all states anyway, for public health units. And that's the end of the module. Any questions on that one? Okay, all right, what I'm going to do now is I'm going to show you what we go through with a practice in terms of publishing their plan. We make sure that we reiterate that this black button at the bottom right is clicked and the green tick is put in there. Once that's done and they're happy that their sections are complete, we go down to the bottom left-hand side. You've got 2 red buttons. I'm going to click on the publish a version, and I'm going to follow the prompts. Okay, and here it is. It's just popped in here. Usually takes a moment. Now this is printed in PDF format and will automatically configure to the practice's printer setup and print in A4. So this is what they get. Can you see that okay? Can somebody just give me an indication that they can?
Yep, absolutely.
Okay, great. So we've got the emergency response plan, the ERPT. Oh, one thing I should have said, the version. There's always a version control. So right out of the beginning at the front page, it'll tell you what version you're up to. Now I've got a huge number here because I'm in and out of this quite a lot. But if you're a typical general practice and you've had the ERPT for a few years, you may be up to version 5 or 6. College logo, name of your practice, the single point of contact, where hard copies are kept, and any documents that are uploaded, remember the upload button, then all the contact details for that practice, when the review of the plan is going to take place and by whom, what are the first 5 things that a person in the practice, because typically if somebody has to grab this, it may not be the practice manager or the principal GP. They may not be there. It may be someone else in the practice. So these are the first 5 things that they have to do. The table of contents, all the staff contact details on one page, including where they live and how long it takes them to get into work. The staff call-in tree, and I've seen this with a very large practices as well. So the staff call-in tree's gone over 2 pages. Key contact information for support agencies and service providers, all on a couple of pages. And then into the risk identification and reduction. So you know how we prioritize those risks in module 3? They appear here now in that order. So the hazard, the likelihood, the consequence, what do you need to do to prepare, respond, and recover for each of them. And then once that is all done, we go into loss of power supply and all those specific. Thanks, Wendy. Wendy's got to duck off. Loss of power supply and then the specific modules down the left-hand side. So what the practice ends up with is about a 50 to 52 page document. All the pages are numbered, and when the plan was published is also notated at the bottom right. Okay, so that's going through the modules as we would with a practice. So Katie, can I maybe get some comments from you and then questions from others if there are any?
Yes, yeah, people can pop any questions in the chat box or unmute yourself and ask. It's certainly really comprehensive and so much information, John, contained through completing that. It's wonderful.
No problem. Now, one thing ahead of any questions, one thing I will say, we do get practices coming to us from time to time saying, oh, look, we've got multiple locations. What do I do about that? So there may be, you know, one administrator, but there's 3 practices. So typically what we would say to that practice manager is, because there will be some common suppliers. So we say complete one plan for one location, and then make sure that you've got that printed off. And then we will sit online with you and we'll help you duplicate your plan and rename it. And the way that we do that, you can see it down here, but it's got to be done from the practice end, because if I do it, then it goes into my database. But from the practice end, they would just hit the duplicate button. That would then give them the ability to change the name of the practice, and then they've got exactly the same plan, which then they can localize to that newly named practice, if that makes sense. It just saves an awful lot of time because, as I said, there'll be some commonalities.
That's a great point, John. We have quite a number of practices that have a different site, so that's really, really relevant.
Yeah, great.
There's just a comment in here, I'm sure you can probably see it, from Wendy saying they keep a copy of their plan in their spill emergency kit. So if an emergency happens and they pick that up, they've got a copy in there as well, which seems
great.
Like a really
excellent.
smart thing to be doing.
Yeah, that makes sense.
Yeah.
Yes, don't forget, given that it's a cloud product or online product, you can access it with your username and password. That's right. Now there was a question there from Wendy that just dropped off. Katie, have you still got that? I can't quite see it.
Yeah, so Wendy said she was a bit late coming in. She's just asking if you can explain about updating the plan. Does it pre-populate the information from your previous plan?
Yes, it does. Wendy just came back with another message and said, yes, I think you've answered that question. Yeah. So absolutely it does. And then what you would then do is go into the section where you need to localize it and just make the changes accordingly. Much more simple process.
Saves a lot of time too. That's great.
Absolutely. Yeah. The other question we get too, Katie, is how often should you review your plan? Now, I covered that at the beginning a little, but the recommendations are, because we know how busy practices are, if you can, do it 6 monthly, and that's why we put that download button, calendar reminder button, but at the very least do it yearly, because it's important. It's not about compliance or adherence to, you know, the GP standards and therefore, you know, getting your accreditation. It's about having an up-to-date, accurate plan in case something happens. Now, I can recall a situation in North Queensland where practice in Bowen got hit by Cyclone Debbie in 2017. They had just updated their plan. They had a hard copy at home. They couldn't get into their practice for over a week. So they couldn't stop the event, but what the plan ERPT enabled them to do was they've thought about all the contingencies around setting up at a different location, getting the utilities stored back as quickly as possible, and telling all their practice staff to work from home for a period of time. So they didn't panic in that scenario because they'd thought through it. And that's the benefit of having a plan.
So if everyone can just take a moment to scan the QR code, we might send it around in an email as well just to follow up. It should only take you a couple of minutes, and just highlight, if there are any further learnings that you have after this session, either on this style of topic or anything else that relates to your practice. So we always really appreciate your feedback. And as we mentioned at the beginning, we will be doing 2 further sessions of this. So if you missed some of it, or you've got other staff you think would benefit from seeing the run through, please just pop in and register, and we'll the meeting link will be the same for the following 2 meetings as well.
Yeah, that's great, Katie. One other final thought too, just to leave people. If they are in the ERPT and they do want any support, at the top of the ERPT, there's a button that says support at the top right beside sign out. Now, if you click on that, it's got a 1-800 number that you can call, and it's also got an email address that you can put any queries back to ourselves.
John, we've just got a bit of a PHN question. Is there a
Sure.
dummy version of the ERPT that people can go in, so if they get asked at a point in time in the future to support a practice with it, just to familiarise themselves? Is there a dummy version or a practice version?
Yeah, so that we get that question asked quite a lot, Katie. So what I can do, that demonstration one that I've shown you, I'm happy to put that into a PDF soft copy and send it to you, and you can print it out if that is helpful.
Wonderful, thank you. You've covered everything very comprehensively there, John. Thank you so much for your time today.
Oh, it's my absolute pleasure. Lovely to talk to you all.
Yeah, and thank you everyone for joining us. We hope you have a wonderful afternoon.